Now, it's been over a year since COVID-19 first hit South Africa, and since then, almost everyone has been living in fear. Analysts, as well as unions, believe that the psychological toll that the pandemic has taken on frontline healthcare workers is even higher than what is perceived. Joining us to discuss the risks to the mental as well as the physical health of healthcare workers is Kevin Halama from the Health Personnel and Other Services Trade Union, Hospersa. Mr. Halama, good to have you with us on the Daytime Update today. Now, as it's rightly said, specialists and analysts can only conceive of the extent of pressure that healthcare workers have been facing. Now, it's been over 18 months. You who are on the front line, you who engage directly with them, what has been their personal experience? What are some of the stories that they are sharing with you?
Good afternoon, Tammy, and the viewers at home. It's really been a very tough time for the health workers. It's actually been very terrible, I might say, in that we've had stories of health workers losing their colleagues on the line of duty, and just to have to deal with the mental toll of losing patients on a daily basis due to the pandemic, and also feeling very helpless and not knowing when is this going to end. I mean, we've had wave after wave after wave, and now even when the health workers got vaccinated, a lot of them in April, there's still a high prospect that we will be facing a fourth wave later on in the year. So it really has taken quite a huge toll on them, and we can only feel for the health workers and offer them the best support that we can.
And what type of mental support are you able to offer them? One can imagine what that sustained pressure day in, day out does to the mind, let alone the body.
Look, it needs a wellness approach from the different facilities. I mean, all the facilities within the Department of Health, they do have wellness committees. Those committees need to be very active at this point in time to ensure that the employees do access psychological assistance, they do access the number of rest time at home, and we go a little bit extra in ensuring that the wellness of the healthcare workers is put forward. But sadly, Tammy, to be honest with you, the situation on the ground is very, very dire. I mean, if we look at the staff shortages which have impacted the number of employees that can operate within a facility, one can only imagine how much can health workers do in that they're working in a heavily short-staffed environment. And it's often very scarce that you find that health workers do find time to actually take a breather during this pandemic.
Government did say that they would be adding more staff to try and alleviate that type of pressure. Has that materialized?
To be honest, earlier I spoke with our provincial manager in Limpopo, and he said that when they engage with the MEC in that province, the issue always goes back to budget, especially in the public sector. So we've noted that in Limpopo there is that issue around ensuring that vacancies are being filled. However, in Gauteng, we've seen that the trajectory is much different, in that the MEC for Health in Gauteng and probably even the Premier have come forth in that they are addressing the issue of staff shortages. They've employed, I think, contract workers, and that has alleviated the pressure on the permanent staff within the department, as well as in KZN. I might also just touch on the private sector, Tammy, in that in KZN, when I spoke with my colleague earlier, he mentioned that the private sector has actually improved some of the working conditions or even the incentives to try and retain some of the quality staff members that they have within their institutions. We've recently signed a plus 5% wage increase in one of the live hospitals, and that employer has even gone as far as saying that they're going to be paying some of the council fees which some of the professions pay, like your HPCSA. So that is some of the trends that we are seeing in the private sector as well as in the public sector.
Just a short while ago, we had medical students who had completed their academic training but still needed to do their internships, decrying the fact that they had not yet been placed. What is that current situation now? Have any of them perhaps been called upon to fill some of those positions?
We're still hovering around the issue around the wage freeze. I think it's well documented that since I think a couple of years ago, the former finance minister made a statement that we should expect in the public sector a 3-year wage freeze. Unfortunately, in the health sector, that impacts on whether the department can employ more staff. The ComServes, which are some of the graduates which do their practicals in some of the public hospitals, unfortunately, Tammy, a lot of them are facing the prospect of being unemployed at the end of their practicals. Just yesterday, I spoke with an audiologist who was asking where they can find vacancies because their institution has informed them that at the end of the contract they won't be absorbing them. And that goes back to the issue around budgets, in that it seems as if still in the public sector, the health sector, we're still heavily impacted by the wage freeze, whereby departments are not being given the sufficient budget to ensure that your graduates and your ComServes and the youth can enter the market and actually play a vital role in ensuring that we overcome this pandemic.
Kevin Halama, thank you very much for that update regarding the mental and physical health of the mental health care workers during this time. It really has been an extended period of continued pressure. He is from Hospersa.